Hormones tell the cell what to do. Endocrine disruptors, like xenoestrogens, give incorrect information about what to do. So, it's like you get an incorrect recipe. It says cook at 400 degrees for an hour, but it was supposed to be at 275 degrees for 4 hours. You're not going to end up with the same dish, okay? So you got to have the right instructions. So in terms of hormones, like I said, you need to have them optimally in your body. And guess what you also need? You need them for life. Is there ever a time when you would say, I think I don't need thyroid hormone anymore? You would never say that. You would that sounds nutty. Why would you say that you don't need estradiol, estrogen, or any other hormone? Why would you say, I outgrew it? No, not at all. So estrogen is basically the master hormone that is overlooked in all aspects of female health, including mental health. Now, when I talk about estrogen, I'm going to just tell you very briefly because I don't have the time to go into great detail, but estrogen is not a hormone. Is fat one type of thing? Is there one B vitamin? You would never say you have a deficiency of B vitamin. Like what B vitamin? And if you have a deficiency of B12, it wouldn't be solved by giving B1. So estrogen is a family of hormones, and the one made by the ovary is estradiol. Just like B vitamins have a letter and a number, estrogens have a letter and a number. Estradiol is E2, okay? And we don't have time to go into the others too much, but the hormone that you want when you give hormones to women is for like hormone therapy, I'm not talking as a drug for some special use, is estradiol, E2. So estrogen has receptors everywhere. That's not an accident because it's the hormone of life. You can't be successful with reproduction if you don't have a good neurological system, cardiovascular system, gastrointestinal system, genitourinary system, every system. You need to have every system. I say musculoskeletal. Every system has to be optimal if you're going to be successful with reproduction. So to that end, there are receptors everywhere, including in the mitochondria, the energy factories of cells, which are also controlling the cell cycle, which means autophagy, apoptosis, rejuvenation of cells, and elimination of old yucky cells, sometimes called zombie cells. So the menstrual cycle is not well respected for what it does beyond just fertility. When you have the hormones going up and down, they're turning on and off genes, including tumor suppressor genes. They're up and down regulating receptors. So this is not static. And progesterone downregulates estrogen receptors. Estrogen upregulates progesterone receptors, testosterone receptors, thyroid receptors. So there's this beautiful rhythm of hormones that we lose when you have irregular cycles in reproductively, we'll say, challenged women, like women with PCOS, and of course in every woman as she transitions into the post-reproductive state known as menopause. So we need to understand that these hormones are put in our bodies for life, not to give us cancer, but to actually prevent cancer and to run the show of every single organ. And the amount of estrogen matters. If we go back for a minute and look at the menstrual cycle, during the menstrual period, which is at the beginning of the graph, the estradiol level is the lowest. The estradiol is the blue line. You see it's low, then it rises, and then it spikes up. That's what triggers the LH spike, FSH spike, and ovulation. When you have high levels of estradiol, it's very anti-inflammatory, and that makes total sense. If you have sperm coming in, remember, the whole prime directive of life is reproduction. When you have sperm coming in, the immune system will kill them, and then the developing embryo, if you don't have some anti-inflammatory effects. So high estradiol, like with the spike, that is very anti-inflammatory. When you have low estradiol, like during the period, it's more pro-inflammatory. A menstrual period time is a pro-inflammatory time. You make pro-inflammatory prostaglandins in the uterine cavity. That's what creates cramping. If the cramps are too bad, terrible, then you have too much inflammation. That's a clue, okay? And you also are getting rid of dead and dying cells. That's why you have a little bit of cramping. It's like a mini micro version of labor, okay? Everything in the body is kind of replicated. Progesterone is very anti-inflammatory so that you also don't kill the embryo if you conceived, right? So everything is about maintaining fertility and successful reproduction. Now, if you look at the luteal phase here, when you have high progesterone and you have pretty high estrogen, but I told you progesterone downregulates estrogen receptors, and you may have some other issues going on genetically. So one of the things that we now know with like PMS is it can be that you're too much downregulating the estradiol receptors. So sometimes it can actually be treated with estradiol, but progesterone itself is very anti-inflammatory and increases GABA, so sometimes that can help. That's why it's a highly individualized situation. And we'll talk more about the issues with the autonomic nervous system as well. So when you give hormones to a woman in menopause, are you looking to be more pro or anti-inflammatory? You don't want to be pro-inflammatory. I know you know that. So why would you give the lowest possible dose? Think on that. You want to give in everything the optimal dose, which is not the lowest possible dose. It's a physiologic dose. So we got to get over this fear of estrogen from the Women's Health Initiative, because that wasn't bioidentical estradiol. It was conjugated equine estrogens, which have a totally different effect. It would be like looking at the impact of trans fat and then saying never eat the best virgin organic olive oil. What the heck? It's a totally different thing. So don't get those mixed up, and don't be afraid of estrogen in the form of transdermal estradiol. Please. There are a lot of things in this world to be afraid of. That isn't one. And when you have the right amount of estradiol, wonderful things happen. Look what I put at the top. The brain. Of course, the brain, I'm going to show, has all these receptors for estradiol everywhere. You have proper energy. You've heard about mitochondria and energy. You have everything homeostatic. We'll talk about what that means. It means everything is like good with the world. Everything is adapted to be functioning optimally. But it's not just that. It's every organ system. Adipose tissue. You have proper beta cell function, liver, muscle, and the immune cells. Every immune cell in the body has estrogen receptors. The innate immune cells, like macrophages, mast cells, neutrophils, they're predominantly alpha receptor. And things that make antibodies, like the B lymphocytes, they are predominantly beta. So that's important in pregnancy, which I can't really get into great detail. But estriol, the estrogen that's made by the placenta, is predominantly beta agonist. So it's going to affect the alpha, because we know that when you have high beta, it downregulates alpha. So pregnancy is a state of immune modulation. You're downregulating the activity of the innate immune cells. That's why women who have multiple sclerosis and other autoimmune diseases will often go into a state of remission during pregnancy, because it's modifying your immune system significantly so that you don't kill the fetus. And progesterone, as I said, is highly, highly anti-inflammatory, which is also participating. But we're not ever going to try to replicate that state in a postmenopausal woman, because that is inappropriate. We don't want to downregulate our ability to fight off infections. That's why women who are pregnant have a higher rate of complications if they catch COVID, the flu, chickenpox. We're not trying to create that for postmenopausal women. And women who are pregnant become somewhat inflammatory. It's sort of an interesting state, because they get some leaky gut, and that creates insulin resistance, but just a little. When you go over the edge, then you have gestational diabetes. But when it's just on the edge, you have a little higher glucose, a little higher insulin, so you get glucose to the baby to fatten up the baby really fast, so the baby needs food, and you have more fat stores on the mom. That's why women in pregnancy can gain weight with hardly eating more. But that's not what we want for postmenopausal women. So if you're giving bias, please stop. That makes no sense. Now, estradiol is the estrogen that the brain loves, not estrone, which works on the alpha receptor. Okay? So in adult women, there's E1, estrone, E2, estradiol, E3, estriol. So estriol is the dominant pregnancy estrogen. Estrone is made when you have a lot of inflammation that upregulates aromatase in fat tissue. That's why postmenopausal women tend to make, and also older men who have big bellies and man boobs, they're making estrone in their fat tissue, and that's what causes their prostate. I told you I'd talk a little bit about men. Their prostate is the analogous organ to the uterus, and when you have inflammation, the prostate can actually activate aromatase and turn the testosterone into estradiol, and estrogen, among its many wonderful features, but here it's being misused, misguided, creates growth factors. So you grow the prostate, and you don't want to have a big prostate. But most men do because of inflammation, and that's a big problem for men. But they also have inflammation. They make too much estrone, and then they get the man boobs, and they have all the inflammation. But women get that too in their own way, and that is the estrone. And in the brain, and by the way, birth control pills like ethinyl estradiol, conjugated equine estrogens, and oral, even estradiol taken, is primarily converted into estrone. The brain doesn't like estrone, okay? It does not help the neurons to be neurogenesis, to have new neurons and so on. So that's why you should only give estradiol. The brain makes estradiol. It's a neurosteroid. It's made in the brain. In reproductive years, men make 6 to 8 times as much estradiol in their brains as women do. Men, you should love estradiol. You have so much of your body working because you're converting your testosterone locally. It's not systemic. It's called paracrine. Endocrine is where you make the hormone and it travels to, in one place, travels to a different site where it has its effect. Paracrine is local. Men make tons of estradiol from their testosterone, which is one reason why they need to have a lot of testosterone. But testosterone has its own unique receptors as well. So we want to have plenty of estradiol in the brain. And after menopause, or women who just don't make enough, like they have hypothalamic amenorrhea, like they have anorexia, they're not making estrogen, or they're making it inappropriately, like with PCOS, then their brains don't have enough estradiol for all that's needed, which we're going to look at here. Now, let's talk about the most common endocrine disorder of women, polycystic ovary syndrome, as an example of how reproductive aged women can have problems with low estradiol production. Take out from the equation the high testosterone. Okay, that's part of what it is. But if we just take that out, it turns out that the other issues that are not related to acne and facial hair, that type of thing, they're about estradiol insufficiency. Very few people know that. PCOS is a condition of estradiol insufficiency. Now, they may be making a fair amount of estrone in their fat tissue, but when you have high levels of inflammation, which postmenopausal women have, systemic inflammation, and PCOS women, inflammation downregulates the enzyme to convert estrone into estradiol. They can go back and forth, estradiol to estrone with enzyme. But when you have inflammation, that enzyme is downregulated, and the estrone that's made is not converted hardly at all into estradiol. So you end up with stuck in estrone. Estrone, which is on the innate immune cells, activated through alpha receptor. So the estrone activates through its alpha receptor promotion, agonist activity on the innate immune cells to be inflammatory. Estradiol modulates inflammation, turning it on and off. And I'm going to show you how that works with the autonomic nervous system. Estrone is like the on switch for inflammation. It doesn't have the off switch. Estriol is more like the off switch, but it doesn't have the proper on switch. I mean, of course, that's simplified, but that will kind of stick with you. So if we look at PCOS from a metabolic point of view, and you look at all these things, what does it look like? The same problems you get in menopause. See, take out the testosterone part, and you're left with the metabolic part, which until fairly recently wasn't even like acknowledged that PCOS has all these metabolic issues. You have insulin resistance. You have eating disorders. Binge eating disorder is really common in women more than men, and PCOS has it, and so does menopause. And you know there are published articles showing you can treat binge eating disorder with an estradiol patch because it's about estradiol insufficiency or deficiency. Dyslipidemia, visceral obesity, GI problems, leaky gut we're going to get to, endothelial dysfunction, hypertension, metabolic disorders like fatty liver, sleep problems, and mood problems and cognitive problems are common in both. All of these are related to insufficient or deficient estradiol. So just as a quick, how is it that PCOS women don't make enough estradiol? Well, if you look at this just quickly, you see on this one, here's the pituitary. It shows decreased FSH, increased LH. LH is the hormone from the pituitary that causes the ovary to make testosterone. FSH helps the conversion through the action of aromatase in the ovary to convert the testosterone into the testosterone into estradiol, and FSH also shuts down the production of anti-Mullerian hormone, which is what recruits the follicles. So if you don't have enough FSH, which is what's happening, you don't shut down the anti-Mullerian hormone. That's why that's high, part of PCOS, and you keep recruiting those follicles. That's why you get that ring of pearls, all those tiny little cysts around the edge or the cortex of the ovary. And so you have a situation where in PCOS ovaries, the enzyme aromatase isn't working optimally and FSH is not being produced optimally. We don't know exactly why that is. It's partly genetic, but it's being aggravated, which I'll show you in a minute, by endocrine disruptors, and that is happening in utero. So, which is malfunctioning, causing malfunction in the brain in these ways. So you have too much LH because the brain has sensors for estrogen and saying, brain, okay, you're not receiving enough estrogen, put out the signals to the pituitary to tell the pituitary to make the ovary make more estrogen. The precursor to all estradiol is testosterone. So it's like an assembly line. You can make testosterone perfectly, but you can't convert it to estradiol. So the brain says in its sensors, not enough estradiol. So it puts out more LH, more testosterone, but not enough estradiol. So you end up with too much testosterone and not enough estradiol. It's not really that hard. The hard part is like exactly what's going on a cellular level, but we're still trying to figure a lot of that out. But when you don't have enough estradiol, you end up having all those same organ systems having problems, just like when you don't have enough estradiol. Like when I showed you all the good things that estradiol does in the brain, in the fat tissue, in the muscle, when you don't have it, you get the exact opposite. You have all those problems. I showed you the metabolic problems of PCOS, which are the same metabolic problems of menopause. And then with PCOS, on top of that, they've now proven that the endocrine disruptors that probably in utero, the one that's been the most researched is bisphenol A, BPA, they alter the function and development of the estrogen receptors. So they're like innately resistant. So the estrogen that is made, the estradiol, doesn't operate optimally. Just like insulin resistance, this is like estrogen resistance. So the receptor, so it's like a double whammy. You don't make enough, and what you do have doesn't work optimally on the receptors. So basically, and like I said, predominantly the research has been on BPA, but we know it's much more complicated. And so you can think of PCOS like an early aging process. And if you look at the way the body tends to change in women over time, you've all seen women, you have patients, they say, what's happening to my body? Like, I'm doing nothing wrong, and I'm getting my belly fat, my muffin top. I can't fit into my clothes. I feel discouraged. I'm starving myself because it's not just what you eat. It's what your metabolism is doing. And women with PCOS, just like women in menopause, have an altered abnormal metabolism, which is related to the autonomic nervous system. So, and you can see what happens. And you've all seen women with PCOS. 80% of them are severely overweight and obese. And women in menopause have much higher rates of obesity and substantial weight gain because of not having proper estradiol levels. And this is just showing as well, women with PCOS, this has been proven, they have impaired gut barrier or leaky gut, which is aggravated by terrible Western diet food, right? The standard American diet just aggravates it, and obesity aggravates it. So you have all these different things coming into play, and insulin resistance, inflammation, and the goal is to restore. So we're going to go over like what the heck to do about this. It's not just can't be all bad news, have a good day. No, we have to have solutions. But you know what the first step in solving a problem is? To actually understand the problem. It's hard to solve a problem that you don't even know what the problem is. That's like, you'll never get out of that escape room, I can tell you. No clues at all. So menopause. Menopause is like, like natural, 45 to 55 is normal, and you don't have periods, you don't have reproduction. But what it's really about is the bottom line, extensive alterations throughout the body. It's not just about reproduction, because reproduction and metabolic health are one and the same. The nature evolved women to be a global functionality, and you can't. So, okay, do you know why menopause even happens? I did not know. Because like nobody taught me. So at first I was really mad. I was so mad at nature. It's like, why did you do this? Like what is this? It's not Mother Nature. It's nasty nature. What is this? So now I figured it out. It's not to get rid of us, as I kind of thought. It's to keep us from dying. Because once you understand, which I figured this out a long time ago, that every process in the body is linked to having optimal fertility. and reproduction that's successful. And it's all linked to estrogen in the form of estradiol and progesterone too. I'm going to talk in the future much more about progesterone. I was talking about it's like the second child. You know, nobody pays attention, no photos. But progesterone, if you hear me, progesterone, I promise I'm going to do a deep dive and explain why every woman who has a hysterectomy in menopause still needs progesterone, okay? But for now, I want it to be understood that the reason we go into menopause is so we don't die in childbirth. Okay, I did lots of deliveries. You know, I saw every complication, lots of high risk. A woman in her late, mid-40s, 50s, 60s, ongoing, if she's fertile forever and she got pregnant, she will die. Okay, I guarantee it. She's going to have every complication in the book when she gets older and older and older. And not only that, when are we talking about? Like thousands of years ago? Like we didn't have neonatal ICUs. Okay, didn't happen. We didn't even have IVs. We had nothing. So those women would die. So if they died, nature wouldn't cry. Okay, let's be real. But here's the thing. Their children wouldn't have a mother. So who would raise their existing children? So nature takes away our fertility so we will not die from childbirth or being pregnant, and we will therefore be able to continue raising our existing children. And unfortunately for us, it is what it is. Reproduction, metabolism, hormones, everything is together. It's a package deal. It's an all-inclusive. If you have to get rid of fertility, you get rid of all those other things that keep us optimally healthy. But now we can, as smart people we are, we can give up the fertility but maintain the hormones so that we maintain optimal function despite not having fertility. So menopause has been so egregiously addressed as nothing. It's just natural. Yes, it's natural so that we don't die in childbirth, but it doesn't give us healthy longevity. It gave us what I call the 10-year decade halo of estrogen effect. Most women will not have, if they were reasonably healthy, clinical manifestations of all kinds of diseases until they get into their 60s. But that doesn't mean bad things aren't happening, just like what Dr. Bredesen said with the brain, that the bad stuff is happening long before it clinically manifests. But there's not like a heck of a lot of clinical manifestation of disease, but there's the night sweats and hot flashes, which has its own set of terrible side effects. So, but in terms of high blood pressure and heart attacks and strokes, there's not that much of it in women in their 50s. So most women who went into menopause thousands of years ago, which wasn't that many, because I looked it up. In Egypt, when we have the first record of history written, the wealthy women, if they survived childhood, their average life expectancy was 35. If you went to the year 1200, it was if you survived childhood, it was maybe into the early 50s. So it wasn't like living in menopausal state of being was a big thing, okay? So that's really a modern invention, that we could spend half our lives as menopausal women. So, but we need to accept that hormones matter, that these are really important for all optimal organ function, and that when menopause happens, it's the beginning of a huge metabolic shift. So that's where PCOS, and if you don't have enough hormones, like if you have anorexia and hypothalamic amenorrhea, if you are in any state of estradiol deficiency or insufficiency, you're going to have a pro-aging effect on every organ system. And if we just focus on the brain, it's every bad thing in the brain that you can think of, every single bad thing. So what happens? You see there's a fluctuation in estrogen. It goes up and down. It's like a crazy time because like you have overshoots. The brain says not enough. It puts out high levels of FSH, LH. Whoop, it shoots up. Then it goes down. Then it shoots up, goes down. And then it just goes down. Okay, down, down, down. So you see that the progesterone estradiol is just going down. Then you're in menopause. It's just really low. Well, now, all of that was the prelude to the substance, because I had to give you, that was all introduction, guys, because now we're to the autonomic nervous system, okay? But if you didn't understand everything I just told you, none of this would make any sense, okay? So now you see a similar graph. You see the hormones going down, and what do you see here? The blue line going up is autonomic imbalance, and then the other lines are risk of cardiovascular and cognitive disorders. They all go together, by the way. It's an organ system togetherness. That's why I scratch my head when I see articles. We just had a discovery. Women who have osteoporosis have higher rates of dementia. It's like snore. It's like, of course, because it's all one body. Everything's going south. It's just that some people manifest more with one organ system or another. That's why cardiovascular disease is linked to, you name it, right? That goes bad with aging. Cognitive decline, musculoskeletal problems, osteoarthritis, autoimmune. And look up here. You see where it says premenopause, and you have more parasympathetic than sympathetic. Parasympathetic should be the baseline. That's vagal tone. It's like the calmness of the body. Like they talk it like rest and digest. That's where you should be when you're not fighting battles. You're not fighting pathogens. It's just a peaceful day. You're parasympathetic. But look what happens. You haven't done a darn thing. Just by losing your hormones, just by having the decline, when you're perimenopause, look, sympathetic is increasing. Now, sympathetic doesn't mean I have sympathy. It means S. Think of sympathetic S for stress. Stress. And that's the response that you should have when you need it. Like you're being attacked, you have an infection, you have trauma, not just, well, it's another day at the office. But look, I'm like really high in sympathetic tone. No, we do not want that. And then look what happens when you're postmenopause. You have flipped, and you now have small parasympathetic, and you're almost all sympathetic. So your life is nonstop stressor state. And what's the stress response? Well, I'm going to show you. You do not want to live in a chronic state of stress. So just in case you did not believe me, but I know you did, but just in case, these are showing the estrogen, these little symbols, the little like arrow down that says ER alpha, the little curve looks like a little smiley face, little red lips, that says ER beta, the GPER, that stands for G protein coupled estrogen receptor, and that is PR for progesterone receptor and FSH receptor. So what do you see here in the brain? The hormone receptors for estrogen and progesterone everywhere. So if we look at, you're going to learn tomorrow from my friend Jim Greenblatt about the amygdala, emotion, and motivation. But did you know that estradiol and progesterone are critical for proper regulation of amygdala function? And look at every part of the brain. Working memory, executive function. Now it says under hypothalamus, reproduction, and homeostatic regulation. What does that mean, homeostatic? It means metabolic function. It means operating your appetite, whether you'll eat or not eat, to regulate energy intake and utilization. Insulin function, sleep, sweating, temperature regulation. That's all considered homeostatic regulation. If you don't have enough of these hormones, it malfunctions. Cardiovascular, autonomic function. So that's why so many women in menopause will have palpitations. And you'll see many of them are put on beta blockers. Beta blockers is trying to block the action of the sympathetic nervous system's neurotransmitters. We'll see that. It's all about the autonomic nervous system. But what is controlling the autonomic nervous system? Estradiol and to some degree progesterone. But we're leaving progesterone off because it's more dominant. It's estradiol. Estradiol. So when you hear about the vagus nerve and autonomic nervous system, think, and what's the hormone situation? And for men, I already told you, they make tons and tons of estradiol in the brain by converting your testosterone. So you need testosterone for all these functions because you convert it to estradiol in your brain, because it's not circulating, but it's in your brain. And so if you read this, it says, estrogen, you can see it's British, signaling has been proposed as a key modulator of women's neurological function associated with learning and memory in the hippocampus, executive function and working memory in the cortex, emotion and motivation in the amygdala, homeostatic regulation, the hypothalamus, the adrenergic system. The adrenergic is talking about adrenal gland that's regulating all the adrenal functions, and cardiovascular autonomic regulation. And when you don't have enough, when you have all these different symptoms of menopause, it can be explained in this way. And progesterone receptors are throughout the CNS, and their activation has been shown to be neuroprotective during aging, which is why you always want to give progesterone to your postmenopausal women on hormone therapy. And FSH, now I'm even rethinking this. High FSH can create anxiety. So should we be treating FSH levels to be announced? Okay, I haven't made a final decision yet, in my opinion, but it's in my brain now, thinking about that. And so when you have these changes, then you end up, having all of the problems. So I never want you to think that estradiol isn't important for all of these functions that you've been learning about. This whole conference, you don't have those hormones. None of these things are going to be right. So here it talks about autonomic dysfunction and chronic disease. So it's really hard to read, but hopefully you can see it later. But this shows every organ system is affected. Every organ system. And if you look at just the CNS, it says anxiety and fatigue and brain fog and pain and vertigo, dizziness, weakness, exercise intolerance, headaches, sleep problems, and that leads to all these other terrible things. And cardiovascular, tachycardia, postural tachycardia syndrome, orthostatic hypotension, all of these things that like POTS syndrome is, of course, autonomic dysregulation. All the gut problems, all of the vasomotor, that overactive bladder, that have the gotta go, you heard about that? And the drugs that are given, this is all about autonomic dysregulation. The problem is those drugs that are given, they block some of the receptors for the neurotransmitter involved, which involves acetylcholine through the first part of the sympathetic nervous system, what's called muscarinic receptors. But in the brain, they're also blocking some of those receptors, which is why on the label for those drugs for overactive bladder, it gives a warning, may cause dementia. So anyway, I looked at it, and in typical fashion, you will have one fewer trip to the bathroom to avoid if you take those drugs. So I think it's not worth the risk of dementia and dry mouth and all the other constipation and stuff, because you're messing with the autonomic nervous system. So what the heck is the autonomic nervous system anyway? It regulates everything in our body we don't think about all day long, in every organ system. It's just how our body works. Can you imagine if you had to say, eyes tear, sweat now, stop sweat, gallbladder contract? I mean, you would not get through 5 minutes, right? So what do we have here? If you look here on the sympathetic side, this is like the yin yang. Remember, the sympathetic should only be activated when you need it, like under stress situation. But you see under the sympathetic side, it has the adrenal gland right there. So you've all heard about adrenal. So what the heck is with the adrenal? Like adrenal fatigue. The adrenal gland is just the recipient of the signals. The adrenal gland isn't sick, okay? The adrenal gland is getting too much sympathetic output from the autonomic nervous system that's creating this regulation, like say too much cortisol and then eventually maybe not enough cortisol, but it's all coming through the autonomic nervous system's signaling. That's why our adrenal adaptogens that we'll touch on may be helpful. But you can see every organ system is involved, and this is the peripheral autonomic nervous system. The other part that I showed you earlier in the brain is talking about the brain part. The brain and the peripheral communicate. They're all one system. So sympathetic here, and the main thing here, I'll jump over here. In here, let me just read the top line, because you need to know about the neurotransmitters for the system, because they're totally modulated by estradiol. Yes, estradiol. So there are 3 main types of neurotransmission in the peripheral: and also the central, this is just talking about peripheral, autonomic nervous system. Cholinergic, mediated by acetylcholine. Adrenergic, that's like when you get, a beta blocker. It's talking about the adrenergic system, mediated by norepinephrine. So if somebody has an asthma attack or like an allergy attack, they go into anaphylaxis and they get an epinephrine shot, like an EpiPen, and their heart beats fast because it's working on this system. Because part of the stress response is to dilate the bronchial tree so that if you're running for your life from a wild animal, you can breathe better. Okay, so that's why it opens up the bronchial tree. That's what the epinephrine, the EpiPen is doing. But it's also creating the sympathetic activation of the heart, so the heart beats faster. Okay, and then here as well, non-adrenergic, non-cholinergic, mediated by neuropeptides, ATP and nitric oxide. Now, what about neuropeptides? You've heard about peptides. Everyone's like peptides. Okay, well, what regulates them? Well, it depends how downstream you want to go. Estradiol regulates them. GLP-1, which I'm going to touch on, and other ones. The ones that deal with all the appetite, GIP, VIP, vasointestinal peptide, kispeptins, all modulated by estradiol. And I'm going to show you something on that. Okay. So here's, like it shows, look at the title. Estrogen in the regulation, central regulation of autonomic function. I just show you this so that you will believe me. And here, menopause is associated with decreased heart rate variability. You might have heard of that. What the heck is that? Reduced parasympathetic, increased sympathetic. I just showed you what happens as women lose their estrogen. This is what happens. They become more sympathetic and less parasympathetic. And here goes down at the bottom, the cardiac vagotonic, that means increases the vagal tone, and the sympatholytic reduces sympathetic effects of estrogen. Estrogen reduces sympathetic output, increases vagal output. Can explain why premenopausal women basically have lower coronary heart disease and have lower everything. After menopause, I told you, the chance of having anxiety, depression, and dementia significantly goes up. And this is just showing that this matters in the hippocampus where you have memory, right? So it says on the bottom, this may underlie estrogen's ability to enhance learning on specific tasks. And at the top, estradiol increases hippocampal acetylcholine release. Without estradiol, you will not have optimal acetylcholine production, release, or receptor function. And by the way, that applies to serotonin as well, and dopamine. This is like not optional. So I just want to make sure you see that. Now, here it shows in the heart, okay, that when you have a heart attack, if you give MI, stands for myocardial infarction at the bottom there, when you have add in E2, estradiol, see, it doesn't say estrone, it says estradiol, what happens? You have normal vagal function, normal glutamate, normal mitochondrial function. So you know what the standard of care is now? If a woman has a history of heart disease, don't give her hormones. Does that make sense? Of course it doesn't make sense. That's why my new mission is, lady, you're not too old, okay? Because it doesn't make sense. These receptors don't die. Women can be on Depo-Provera for how many years, decades, and you put them, they still have hormone function, and their hormones haven't been being produced by their ovaries for as long as they're on the Depo-Provera, and no one says you can't have hormones because you're now 38. Come on. It's not about age. It's about health and metabolism and metabolic function that can create risk, which I can't get into now, but that's coming when I explain why every woman can go on hormones at any age. But in here, look at this. This is an immune cell. Here we have afferent and efferent. Everything in the autonomic nervous system with the vagus nerve is bidirectional. Here it shows efferent, that means signals coming from the brain. Afferent is going back. Here's an immune cell. See, that stands for sympathetic nervous system, and you have signals going to the adrenal gland and to the immune cells. So here it says cholinergic anti-inflammatory pathway. When you have proper vagal tone, it's anti-inflammatory to the immune cell. It actually reduces the inflammatory cytokine production. So when you go into a state of menopause or PCOS and you don't have enough estradiol and you don't have enough acetylcholine, you don't have enough vagal tone, you're going to be in a pro-inflammatory state. Raise your hand if you want to live a pro-inflammatory life. No, hands going up. I could anticipate that. Okay, now, so in this busy thing, I just wanted to read the top sentence. Estrogen, a female gonadal hormone, exerts regulatory effects on autonomic neural pathways via estrogen receptor signaling, contributing to cardioprotection and neuroprotection. Then it said throughout the reproductive years, but we're so smart we can continue that post-reproductive years. So no one is going to think that this isn't what's happening, that without estradiol, you're not going to have a proper functioning autonomic nervous system. By the way, I'm just going to rush through this. The ovary has its own receptors, and without proper vagal tone and autonomic nervous system function, you're not going to have proper ovulation. See, it says role of autonomic regulation of ovarian function, and it comes both at the ovary level, the peripheral level, and the brain level in terms of the creation of the little factors in the brain that create the signals to the pituitary. So without proper autonomic function, you're not going to have proper reproduction function. Why is that? Because it's all linked together. It's all linked together. You cannot separate reproduction from anything. It's all linked together. And here, I just want to read the bottom line here. The vagus nerve is one of the neural pathways participating in PCOS development. Okay, so that's why I brought in PCOS and menopause. So you can see this is across the lifespan of women. And in younger age, it's dysregulation. In older age, it just comes with the territory of going through menopause. So I'm going to jump through here with the gut because I'm supposed to talk about the gut microbiome, which is critical. You eat proper food, you ferment, you make these short-chain fatty acids. Now look, they work through the signaling agents. This is intestinal gluconeogenesis. You have signaling, you have the enterocytes that also make things like GLP-1, and here's the vagus nerve, back and forth, afferent, efferent, to the brain. So what is going on here? Well, it's bidirectional, the gut and the brain. You probably know the gut-brain axis. Now this is a really important slide, but it shows here in this little circle here, if you see, it shows that's the vagus nerve, the afferent, okay? So this is the signals going back. And look at those little dots. You know what those little dots are? Neurotransmitters and short-chain fatty acids. They actually bind to the vagus nerve. They actually affect the signaling from the gut vagus nerve ending back to the brain. Okay, that's why it's so important to have an optimally functioning gut to make all those neurotransmitters. You know, the gut is like a massive factory, and you make the short-chain fatty acids. They bind. There's actually binding sites on the vagus nerve for butyrate, one of the key short-chain fatty acids. And here, when you don't have things right, you get leaky gut. Here's leaky gut, and here we have the immune cells coming through, and here's the gut microbes. And then what is this? Pro-inflammatory cytokines. They get into the blood. Here's the blood taking back good and bad. So you want in a good case, you have short-chain fatty acids and neurotransmitters from the gut coming right up to the brain. But when things are bad, you get pro-inflammatory cytokines coming also back to the brain. And here's the vagus nerve showing back and forth signaling. And here's for the HPA axis that's also completely intertwined with this whole system. And you have the cortisol coming out. All interconnected, all part of this beautiful system. And this just shows all the parts of the brain that are involved. This shows that estradiol is really critical for working with the central nervous system and all the different parts of the central nervous system. There's even a part of the gut microbe called the estrobolome designed to metabolize estrogen. Estrogen is so important. And when it's dysregulated, you get all of these bad conditions, including brain malfunction, but all of these other conditions as well. You see, PCOS. And what about the gut microbiome and estrogen? It's not just a recipient. It's actually causing the gut microbiome to be either right or not right, depending on the amount. So here it shows that when you have adequate estrogens, see there's eggs and here's little sperm. It's all about reproduction, guys. And here it shows when you have adequate estrogen, you have proper diversity of the microbiome. You end up not getting dysbiosis. And this line means you're blocking dysmotility. That's like the enteric nervous system is going to function properly. And you're not going to have immune dysregulation. And you're not going to have dysbiosis. Estrogen blocks the problems. And look what I will show you here. When you lose your estrogen, you lose healthy gut microbiome and healthy gut integrity. Here's leaky gut. And see, the gut microbiome changes. And you have, this is microbial translocation is leaky gut. So now you know, it's like all one. You have the brain. You have the autonomic nervous system, the sympathetic. The neurotransmitter norepinephrine is modulated by estradiol as well. And you have the acetylcholine that's modulated by estradiol. You have the gut microbiome that's modulated by estradiol. When you don't have enough, you get leaky gut. And here's an article showing you have altered gut microbiome when you don't have enough estradiol. I have a duplicate slide, only instead of saying in menopause, it says in PCOS. That was discovered in 2015 in China, that when you don't have enough estradiol in PCOS or in menopause, different studies, different people, you have leaky gut. And when you don't have the proper gut microbiome, you get neuroinflammation and all kinds of problems and brain disorders. And if you have depression, it's bidirectional. Depression can give you problems as well. Now, clearly, I needed more time. So here's the thing, because I can't talk faster, but you know, you ever hear a podcast and they up the speed 25 times? Next time. Okay. So, but I have all these, I have a program. So, and you can do adrenal adaptogens, fiber. Because you got to restore that gut microbiome. I showed you that slide where it shows fiber being fermented. And here's resistant starch like cold potatoes. Look what you get. Improved appetite, proper regulation, cognition, gut barrier is fixed, oxidative stress and inflammation goes down, and you actually have better detoxification of environmental toxicants. And look, increased GLP-1, you don't have to spend $1,000 a month on shots. Because you can make it. You know, there's studies showing that if you add estradiol to a GLP-1 agonist, you know, by the way, agonist, it's not real, it's a mimic, you know, like Wegovy and Mounjaro and so on, that they do better. Well, of course, these peptides are regulated by estradiol. You make them naturally when you have enough estradiol. After menopause, women have dysregulated appetite and their GLP-1 isn't working right because they have dysbiosis and problems in their brain. I just showed you that. If you maintain women on estradiol and they eat a healthy diet, you don't need shots. And phytoestrogens, I could spend an hour on them. And almost all your nutritional supplements that are herbals are actually phytoestrogens. Still beans, resveratrol, quercetin, lignans, urolithin A, they're all phytoestrogens, isoflavones. And this is just a quick slide to show you the master clock in the brain, ER, estrogen receptor beta. These are the nutrient sensors, estrogen receptor alpha. All of these systems, look, here's all these peptides, all regulated by estradiol for the purpose of successful reproduction, but also metabolism, regulation of energy, usage, production, distribution, storage. And the circadian rhythm is not a little matter. We can see right here that when you have proper circadian rhythm, you have proper autonomic nervous system function, proper temperature. All of this goes awry in menopause, and the women get, like my grandma, the hot flashes. So let me just tell you one thing at the end here, because so in terms of what to do, Vagus nerve stimulators are amazing, and here you can see it works on everything: the gut microbiome, brain, stress, cardiovascular, and nutrition, appetite regulation, body weight, and so forth. And let me show you here. These are all, and you get the slides, I'm sure. If you don't get them, I'll give them. Okay? And they even have data using a stimulator for PCOS even. I love talking about hormones. So here, let me show you what I have. Because hormones are great, and you do everything right. If you scan the code, my code there, you can get access to my free book on menopause that goes into all this lifestyle.